Thank you so much indeed. It is Equatoria TV. We are coming live from Nairobi, Kenya, where we ensure and we give you lots of what you think and what you feel to do. And here today, we are so much privileged, as we told you that we will be giving you story regarding to cancer and how social life can lead to what we call the cancer. And through that, it depends on who and how we live. Definitely, we are at Texas Cancer Center, where we are most delighted to host one of cancer recoveries. If you talk of cancer, it means very tough situations at a very particular place where you can't get in, particularly when it comes to recovered. And here, Texas has showed something which someone have been never done ever, meaning that Texas Cancer Center have recovered somebody or has treated someone who have been able to ensure that they come out safely. That's very good news for our viewers who are watching us. We are coming live from Nairobi, Kenya. I'm your host, Kaka Juma, just to give you the feedback on what to do and how to ensure that you come out in a particular manner. So through that, it is possible that everything is possible. They say we treat, but God does what? Heal. That is definitely what it means. So through that, we are able to come up with the definitions of all and how it can be. And today I will be hosting Dr. Nyongesa Catherine Wata, who is the CEO for Texas Cancer Center here in Nairobi, and a very big hospital to ensure he gives us more details, or she shares the details concerning what it should be done and how we should live, specifically how social life leads to what we call cancer diseases. Cancer is not mainly or necessarily to the old people or to the people who have grown up, but it has come to scale of young people. And for us here, Equatorial TV, we ensure that we give you all details as it unfolds to ensure that you become safely or you get safely. And for that, it is better for us to ensure that we reinstate the situations through giving you the informations and feed you the required informations concerning how should we get treated, where should we go, what we should expect, and how we should move. Specifically in our life, we might be having some challenges, but because of one, two, three of challenges that we face in life, it gives you a very difficult situation for you to go or for you to come out specifically when it comes to cancer. And as we've talked, cancer is most expensive when you compare to other diseases, and it takes even more and more as you become weaker and weaker. But definitely, when you realize or when you go for diagnosis, then a little bit early, and the doctors know how they should handle it immediately, it will end. And that is why we are here to give you how should you finish or how do you supposed to work out closely to ensure that if you have cancer or any other related diseases ends or gets treated. And so far we have got a good message from Texas uh, Cancer Center that has worked closely and they have achieved what someone else haven't been achieved. You can send in your comments while where you're watching us. For those people who are watching us live from Australia, Canada, Egypt, that is in Cairo, and Juba, that's in South Sudan, Somalia, Kenya, Kampala, Tanzania, and other parts of the country, that is Great Manchester. Thank you so much for switching in to Equatorial TV, where we are coming live from Nairobi. And we are so much delighted to ensure that we give you the inner details concerning how should we go when we are experiencing what we call cancer. So here I have the guests, a very energetic lady, and so beautiful. If you look at her, the lady went through what we call the cancer, and she has more experience or she has experienced a lot in her life. And through that, the journey was so tough. She had to go all through sessions, what we call the radiotherapy, chemotherapy, and other definitions you can define when it comes to cancer. And finally, she emerged as a winner. which is a very good and interesting story that we wish to hear from her so that she tells us what happened, how did she manage, and so forth. And today we are so much delighted to have our guest, that is Highline Mora, who is a cancer recovery. A very interesting story that you won't miss it. You won't miss it. Thank you so much, Highline, and welcome to Equatoria TV. Feel free to share with us the story first. How did you came to know that this is now the cancer and I've got the cancer? Start with your name, please.
My name, my name is Irene Mora. I am here in Cancer. I came here in 2019 in breast cancer. I told a doctor, Dr. Nyongesa, I told me, your cancer, when you are the breast cancer, you are a survivor. Then you come back on 2020 January, when you are coming to come to the sales with the doctor. The doctor come to tell me, come and sit down, and I can share to you, I can support to you. Challenging ni pesa, money is the problem. Doctor can tell me, come sit down. When you are don't know money, come to me, see me, and tell me you have for money.
Indeed, it is very interesting, but when it comes to what we call the cancer now itself, I know the challenges to the diseases. It might be of some interesting. For instance, you don't have money, and the doctor is supposed to give you the what we call medication, so it's supposed to have that booking sessions. It was too tough, I know. How did you manage this?
When you are coming to the doctor, can tell me sit down, I can sit. Doctor tell me, when you are don't have a man, come tell me. I can say to you, I can go to chemotherapy, I can go to radio. When you are come back, I see the friends, I can tell them, I can to share to money. When you are saying to friends, when you are to tell me, I have no problems. Mm, tuta- tutakushika tu mkono. Yeah.
So for our viewers, tutakushika mkono means we'll hold your hand when you have a problem. You're supposed to be helped, and through that, the decision. So what happened? The doctor told Eileen that since she doesn't have money, she will ensure at least if she hold the hand of the lady as she seeks what we call medication. But definitely, it is very tough. If you see, cancer recovery is a very hard situations where you can't face it or expect it to be at a certain particular point. But definitely, what comes out is how do you come to realize that you are cancer or you have cancer or they have diagnosed you with cancer. So definitely, it means a different thing. Uh, it comes to what we call the medications and expand what we call life expectation. But you don't have, for instance, for our viewers who are watching us for the first time, we don't realize that one of the diseases that the doctor talked about what we call the cancer keeps on changing with particularly the diseases that exist. For instance, you can be diagnosed as a person with TB, but in really sense, it is not TB, it is cancer. So it keeps on changing, fluctuating from one point to the other. So, Highland, just come back to you. Uh, After going through the sessions, how did you manage to uh, first to pay and second for treatment? How did you manage to get treatment until you came out as the way you are? If you just highlight for us your story.
Nilikuwa na some money, nilikuwa almost 10,000 when you come to doctor. So akaniambia tu kuja hiyo na 10,000, nikakaa. When you come back, akanipea matibabu yenye alinipea ni chemo therapy. Nilianza chemo, nikaambiwa naenda chemo kama 6 times, na hizo zinachukua almost 100,000. So nikamwambia sina hiyo pesa, akaniambia through NHF I can do. So nikarudi kwa friends, wakanifanyia mchango, nikapata almost 50,000. Nikakuja mpaka kwa doctor, ndio nikamwambia nikamfaa, nikamwambia niko na hizo, ndio doctor akaanza kunipea matibabu. Vile niliendelea kumpea, doctor akaniambia usifeel kama uko na kansa utaweza kufa, huwezi kufa, unapona. By the way, nilikuwa naona kama ni mchezo, nikasema hapana, ni Mungu tu. Hivyo ningekuwa kuona hiyo picha ya kwanza wakati nilikuwa na kansa, na saa hii nimebadilika na nimepona, niko sawa. Juu wengi wako nayo kansa wanaogopa juu ya matibabu ya pesa ndio wanasema hawana, ndio wengi wanapata wanakufa. Na kansa haistaki stress. Ukiwa na stress utaweza kufa kansa, kama una stress utasurvive na kansa. Na pesa, usikuwe hauna pesa useme uende enda pata daktari, ongea naye, daktari anakaa chini anakusikiliza, daktari anakusaidia, anakushika mkono, anakuambia tuendelee na utapona. Mimi niliongea na daktari vile niko hivi, daktari akaniambia kuja. Nilikuwa nakuja wakati sina, nakuja naambia daktari ananifanyia chemo, then naenda naongea na my friends wananipea ile pesa, wananipea naletea daktari ananifikiria mpaka nikamaliza chemo. Wakati nilimaliza chemo, nikarudi after 1 week, then nikarudi kwa daktari tena, akanipea some advice. Akaniambia ukienda home usikuwe unakaa kama mtu mwenye uko na stress, usikuwe unasikiliza advice nyingine kutoka nje. Juu advice mingi tunapewa kutoka nje na friends wengine, wanakuambia once ukiwa na kansa wewe utakufa, lakini ukufi. Ukiwa na daktari, ukiwa na madawa, ukiwa na kila kitu unapona. Sasa mimi nimepona, kwa sawa, na naambia daktari nyongeza, namrudishia asante, na Mungu ambariki, aendelee kusaidia na wengine wapate matibabu na waendelee kupona vile nimepona. Sasa hii nimepona, niko sawa, vile nakujanga namsalimia na narudi nyumbani. Kama nasikia kwingine vibaya namwambia, ananiambia hiyo ni homa, hakuna kitu kingine. Kwa hivyo niko sawa.
What type of cancer were you diagnosed with?
Niko na breast cancer.
What happened specifically? Walitoa ama? Okay.
Before watoe, nilikuwa na chemo. When I finished in chemo, then I will go to operation. Vile nilimaliza operation kukuja, nikapewa chemo, lakini chemo ya sindano tu 2, nikarudi home. Then nikaback, nikamuuliza doctor, akaniambia uko sawa.
To our viewers who are watching us live from different places, that is Swahili, the Swahili part of it, but definitely just to give you the scenarios that the lady that is Hailin Mora was diagnosed with what we call the breast cancer, and through the effort of Dr. Catherine Nyongesa Wat, the CEO for this hospital, that is lung cancer, Texas Cancer Center, decided to give her the what we call the medications, but the she had to go to what we call the chemotherapy. After going through what we call chemotherapy, the doctor advised the lady not to have a lot of stress and not to go or be at a particular place where she can be stressed at any particular time. And she gave what we call the best of what she could be doing. And if you look at the scenario, she had to contribute some amount of money for her to go for what we call chemo. And finally, one of her breasts had to be removed. Specifically, if you look at the scenario, it is so much touching. And specifically, if you go down and deeper, you will find it was very hard. Keeping in mind that the family or Highland Mora is from a very what you call medium family or the sizable economically, she could manage even getting 100,000 for mother, but because of the assistance and help from the Nancy, the doctor, she managed to finish the chemo and she went through what we call after being diagnosed, she finished and the breast had to be removed. But specifically, if you look at the two scenario, you will find most of it is a little bit headache and cumbersome. But money needs to be each and every particular stage. You have to have what you call the money. If you look at what we call the process itself, and so accepting yourself is another thing. But definitely, if you look at the what you call cancer recoveries, this is one of them where she can be able to highlight one of the stories and how she used to live and where she thinks the life is supposed to be done. But specifically, Wata is one of the best doctor when it comes to cancer. And if you look at what she's doing, specifically what she's doing, which is a little bit harder, accepting the way you are also is another thing and another scenario. Also, she had to give more of courage, and also what we call positive vibes as they talk to the various people to ensure that they do what we call specifications. But specifically, Highline Mora had to come out. We have many people who have come out from this scenario, but what next comes in and how social life can impact to what we call the our life today and cancer disease. If you look at what is going on right now, we have a lot of emissions of what we call the pollutions. We have cigarettes being smoked, and cancer, as I told you, is not necessary to the grown up, but it has come to also the young ones. So it is now our uptake, or it is now our upkeep to ensure that whatever we do, whatever we eat, how we socialize, also have some meaningful to our life because it might bring what you call the impact. So it was a long journey, as she has explained in Kiswahili or in Swahili language, but as I've interpreted for you, the lady that is Haile Mora had some of the challenges, keeping in mind that she had nothing to work on specifically when it comes to money. And she did not have anywhere to get money, but through the efforts and the help of the Dr. Catherine Nyongesa, through Texas Cancer Center, she didn't look at how much she had to give all the medications itself. She decided to assist, and to where she is or here she is, Haila in Mora, she's going on with her life. So Mora, when it comes to what we call the life and experience, what comes into your mind, because you look at you don't have one of your breasts. So after going through that medications, did they give you another breast or what happened?
Wakati alinipea hiyo matibabu nilirudi home, akanituma niende x-ray, nikaenda CT scan, nikaskaniwa tu hapo kwa matiti, nikapatikana hakuna hiyo kansa. So challenge yenye tunapitia ni pesa. Kama hauna pesa, wengi wanakufa moyo, wanakaa kwa nyumba. Wakati ile sasa imefikia ile kiwango, ndio wanaletwa, wanapatikana, wanakufa. Hawa ndio wanakufanga. Lakini ukizaa gundua mapema na ukikaa karibu na daktari, unapona. Si wale wengine wanakwambia saa hii kitu ni kama imetumwa, hii kitu no. Kansa, kila mtu ako na kansa, isipokuwa ni vile itafika wakati iyeyuke ikuje. Kila mtu ako na kansa, isipokuwa itafika wakati na yeyuka kwako. Kitu ile tunapitia sana challenging ni pesa. Wengi wanakaa kwa nyumba. Wale wenye wanakaa kwa nyumba, wacha waende testi. Umetestiwa, ukipatikana uko nayo, enda kwa daktari, umwelezee, ukae chini na yeye. Alafu kama uko na friends watakusaidia. So far kama mimi siwezi kukwambia kama relatives zangu walinisikilia. Mimi ni friends na daktari. So ndio maana nikapona, niko hivi vile niko hivi. Hata kama nikipitia challenge ni kidogo tu napitia, si mingi. Lakini ninaomba wale wenye wako nayo tafadhali tu waingie hospitali, wafuatilie dawa, wafuatilie daktari vile anawaelezea, wanapona. Kansa, ukikuwa na kansa haukufi, kansa inaponanga. Na kansa inapona wakati ule umejitolea kwa daktari, hiyo ndio unapona. Lakini wakati ukiachilia, mafriends wengi wanakuambia hii huwezi pona, hii ni unakufa. Na ukipata kansa usikuwe unasema sina pesa. Hiyo ndio inatufanya sisi wafifu tunakufa, tunasema hatuna pesa. Pesa, sikiliana na marafiki, usikuwe unaogopa. Enda kwa rafiki, mwambie nimeenda usini, nimepatikana nikiwa na kansa, mtaweza nisaidia aje? Rafiki mzuri anakushika mkono, anaambia marafiki wengine wanakusaidia. Enda kwa daktari, mwambie nimesaidiwa na marafiki, ndio hii ile chenye uko nayo, unapata dawa, unapona. Vile nimepona, hata vile niko hivi, wakati nilikuwa nimeanzia matibabu na wakati huu umeniona iko tofauti mbali. Kwa maana wakati walikuwa wanakuja kwangu kuniona, nilikuwa wengi wanasema ni TV, wengine wanasema ni HIV. Wakati sasa nilikuwa na stress, nitatoa wapi pesa? Nitafanya hii aje? Nitafanya hii, na niko tu vile niko hivi. Siwezi kuambia kama niko na mzee, hapana. Ni marafiki ndio wamenisaidia mimi mpaka nimefika mahali penye nimefika. Na saa zingine nikikuwa kama nastahili kwenda check up nyingine, naomba tu wananisaidia, mwenye ananisaidia mwito wangu ananisaidia. Ndio sasa nimefika mahali penye nimefika. Na hiyo ndio nasema challenge ziko mingi kwa hiyo ugonjwa. Lakini nawaomba tu wale wenye wako nayo waende hospitali, wanapona. Hii kansa huwezi kufa. Hapana. Hata wakati nilikuwa nayo walikuwa wananiambia naenda kufa wengine, lakini naambia mmoja, hapana, Mungu wako, Mungu alisemanga ukikuja kwangu unapona. Ukienda kwa daktari nayo, ukielekea kwa daktari nao unapona. Lakini ukienda kusema wacha nitumie hii, ndio maana wengi wanapatanga hiyo challenge. Saa zingine wanatuacha, saa zingine yani wanaisiwa nguvu katikati kabla wajamaliza hii safari.
Let's talk about how it should be done and how the process you went through specifically. When we look at what we call the expedition itself, how the respondent make it to the scenario. To our viewers who have joined us, thank you so much for joining us, and thank you so much for sending in comments. You can tell us where you're watching us. Specifically, when it comes to matter of health, it is a little bit hard and cumbersome for you to understand. And it is they say a person who feels difficult, the body is the one that represents the difficulties she or he is undergoing through. And through that, we will be able to come out. Just to explain to you what Hailin is talking about is that she had a very challenging life when it comes to what we call the life itself. After being diagnosed with what we call the cancer, she had nothing to work on. She had nobody to help out. But through the help from friends and the Texas, let's say the Texas Cancer Center CEO, she managed to be where she is. And talking of that, she has given a very strong message that if you have cancer, for instance, you'll be told different things about yourself. You'll die, you will do this. But definitely, if you have that, is what we call positive vibes, it will give you and gives you what we call push moments for you to go to a certain extra mile and come up with achievements. If you look at the lady, she has talked of people nicknamed her with different names, being positive, having the TB, but in really sense, she knew what she was going through because through your body you can be able to identify the challenges or where the shoe pinches you. So after being given different names, she went to diagnose. They diagnosed her with what we call the cancer, and they started what we call treatment. It might be very hard for some to do so, and some get to give up because one, I don't have money, I'll not manage it. Come to what we call Texas Cancer Center, it gave her another promise of life because she had already been given up, keeping in mind that once you're most of what we call myths and misconceptions is that once you're with cancer, you won't survive. So it is an estimation of some years for you to live and go as they think that you will die. But to her, it was a positive vibes that created or made her to move to where she is right now. And if you look at her health, she's somebody that you can't realize that one time she had what we call a cancer disease. And this is what we call the positivity of how to live in this world. If you get the courage, encouragement, you get that positivity. If somebody else managed to do this, what about me? And that is gives you another mileage. And through Texas Cancer Center, this is where hope is. We have some several guys, but they didn't come on board. But what happened is they said they have witnessed what we call the mighty miracle in their life, highly being one of them. Because when it comes to the revealing what we call the revelations of what should be done, then it is quite unfortunate that you will get what you want. And through that, the effort will be giving you more details and more details depending on how it should be done and where to be. And we will be visiting this Texas Land Center to ensure that we give you more details. So let's talk about now, after being diagnosed, you've gone through the sessions. How did the family take this during your diagnosis or when you are undergoing through what you call medications?
Nilikuwa 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 tu nilikuwa wiki. Wakati unaingia tuseme kama chemotherapy, unakuanga wiki sana, na hiyo lazima utatumika fruits ikuwe mingi kwa mwili. Ukikuwa unatumika fruits, damu inarudi, na ukiwa kemo ya kwanza, kemo ya pili, ya tatu, ndio unaonekana sana sana. Wengi wanalemewa na kemo, wakiwa na kemo ndio wengi wanalemewa sana, na hiyo kemo iko na nguvu zaidi, lazima utumike fruits. Na hizi fruits ukitumika, ukifika kwa nyumba huna pesa, so unaanza kuhangaika, unaenda wapi si urafu unakunywa kama ni uchi, naenda naletewa beetroots na nini inachemshiwa na kunywa. Nikaendelea tu hivyo nikamaliza kemo. Nilikuwa na kemo 6. Wakati nilimalizia kemo 6, sikukuwa na nywele sasa imerudi. Hii ni nywele sasa imerudi kwa kichwa, nywele ilikuwa imeisha kabisa. Nilikuwa sasa nimepaki kama hivi, alafu nilikuwa tu nimekonde sana. Unanyonyanga hiyo kemo, ukishamaliza kemo umepona. Hiyo ndio dawa. Nasemanga dawa ni kemo, ndio inatibu kansa. Juu vile nilimaliza kemo hivi, nilirudi nyumbani, nilimaliza wiki 2, wiki ya 3 nikaanza kugain. Alafu ndio my friends wanakuja wanasema, kumbe mtu anapona. Si ndio huyo mimi nimepona na ndio nywele yangu imeanza kurudi. Saa hii nikisimama kwa wale wenye walikuwa wanasema laughter ni TB, laughter ni cancer, ni HIV. Saa hii wananiambia ni nini hii ulikula? Niwaambia hapana, si ni dawa tu, nimeenda kwa daktari Texas ndio nikatibiwa huko nimepona. Hata wengi nawaambianga nikiwapata nawaambia uko na cancer twende usitafuta nyongeza huko Texas upate dawa upone. Kwa maana nisema kama mimi nilikuwa nimeanzia Kenyatta. So Kenyatta kama ingechua mapema singekuja kufanyiwa operation. Wangekuwa wananitoa hiyo tumor. Kalikuwa kadogo tu. So nikakaa Kenyatta almost 4 months. Nikienda nikirudi, nikienda nikirudi. Nikasema hapana, wacha nirudi kwa nyumba tena nikarelax kwa nyumba. Ile wakati nilienda kurelax kwa nyumba after 3 months ndio sasa hiyo kitu ile matiti ikayeyuka ikaanza kuwa kubwa. Nikakimbia St Mary's. St Mary's ndio nilipata daktari mwingine akaniambia enda mpaka German upiwe x-ray ama ufanyiwe CT scan ulete tuone ni nini. Ile masaa nilikuwa huko German ndio nikapata daktari mwingine akaniambia nataka kulipaa kutoka hapa usiende St Mary's, nataka uende Texas. Kitu ya kwanza nilimuuliza nitaenda aje Texas na nasikia pesa ni juu. Aliniambia no, pesa si juu, enda tu umweleze atakusikia na utatibiwa na utapona. Nikakuja Texas, kufika Texas ndio nikafika hivi nikapata daktari wa kwanza alikuwa anaitwa Dr. Joyce. Nikamwelezea, Joyce akasema ataambia Dr. Nyongesa. So wakaenda wakaongea, ndio nikarudi wiki ya pili ndio sasa nikaambiwa utaweza tumika NHF. NHF nikamwambia sina, nitafanya aje? Akaniambia ile pesa yenye uko nayo enda uweke kwa NHF ifanye. Nikamwambia aje na nastahili matibabu. Akaniambia kuja. Ndio nikakuja, nikatoa ile kidogo nilikuwa nayo na marafiki wakaniongezea, nikaanza. So ile wakati ninaanza nikaingia chemo kabla sijafanywa operation. Nikaendelea na chemo, nikamaliza chemo 6. Wakati nilimaliza chemo 6 ndio ile matiti ilirudi normal. Lakini bado ile dumo iko ndani, bado itatoka. Nikarudi nyumbani nikarelax after 1 week. Ndio nikarudi kwa Dr. Nyongesa, nikamwelezea. Ndio akanituma tena St. Mary's niende nifanyiwe operation huko. Nikakimbia, sikusimama, nikakimbia mpaka huko St. Mary's. Nikamwambia mimi kitu yenye nitatumika ni NHF, sina pesa. Mkiniambia juu ya pesa nitakufa. Kitu yenye mtanisaidia leo ni NHF. Huyo daktari akaniambia ni nani alikutuma? Nikamwambia ni Dr. Nyongesa. Akaniambia sawa, akalifaa ile NHF immediately. Ile siku kesho yake ndio nikafanyiwa operation. Nikatoka nikakuja mpaka kwa Dr. Nyongesa Texas, nikamwambia nimefanyiwa. Akaniambia sasa kama umefanyiwa, dawa yenye inastahili kutumika tena ni hiyo dawa. Ndio nikatumika, namaliza after 2 weeks narudi, alafu nadunga sindano narudi home. Kurudi hivyo ndio sasa nikarudi niko sawa. Siwezi kukwambia kama ninasikia vibaya, hakuna mahali penye nasikia vibaya. Mimi niko sawa, kazi yangu nafanya, kila kitu nafanya. Hata shule saa zingine, hata mtoto wangu ako form 3 ananiambia mama, utapata aje school fees? Namwambia usijali, Mungu ndiye yako. Ndio sasa nang'ang'ana, nikipata friend kama wewe nakuelezea, zile zenye utanipea, mimi naweza toa kwa nyumba kidogo, natumika na nyingine natumika suluhu. Unajua tu maneno ni mengi. Iko tu hiyo challenge ndio napitia mpaka saa hii, naendelea na hiyo challenge. Lakini challenge mingi wengi wanapitia ni pesa. Pesa ndio naomba wa Kenya wenzangu ama yoyote mwenye anayeelewa, pesa ndio iko na shida juu ya kansa. Kansa inapona, kansa haiui. Vile wengi wanasemanga kansa inaua, kansa inaponanga. Kansa inaponanga wakati unaenda hosi kufuata ile masharti ya daktari, unapona. Lakini ukifuata masharti ya marafiki ndio wengi wanapata, na wengi wanalemewa juu wanasema hawana pesa. Alafu wanafuata marafiki wanawaambia kansa, kama kuna kansa utakufa ukifanya. Hiyo ndio mimi nitapea wengine mlai na wengine wanapona. Ila nimepona, niko sasa niko vizuri, hata nikitoa hivi huwezi jua. Nitaisajua kama niko wapi, niko sawa. Na ya kazi yoyote ninafanya. Hakuna kazi ile sasa ni hiyo challenge kidogo ya pesa ndio iko na shida.
Thank you so much, Eileen, for telling us your story. For those who haven't seen or heard what Eileen has just talked, is that I know my brothers from the other side of Canada, Turkey, that is Australia. You might have been passed with this message, but I'll do what you call the translations. Eileen is talking of when she was undergoing what we call the chemo. She lost her what we call the hair. The head was just flat like the face. After she became very slim, that is in body size, but reduced, and she was a little bit so much passed through what we call hardship, and through that she managed to go through what we call the operations, and through the operations, he that is from various destinations here in Texas, she was given various medications here, and through that, after the ball was removed from her breast, this was a delay. After sometimes she delayed for 3 months without going for medications, and the ball grew until the breast became larger. That means that the repulsions of the cells had been expounded more and had been eaten the entire part of the breast. But through that, she managed to go for operation. One of her breasts was removed, and if you look at her, you can't even determine or know whether she doesn't have the breast. That's a very wonderful and interesting story. But particularly, she's given us a message that what normally kills a human being is lack of money. As you can see, she's the mother of some kids, one of them being in high school and several other. That is, but through that, she managed to follow the instructions, and whatever she gathered, she was able to come out and give what to medications or to her medications. And through that, she was able to come out clean the way she is. If you look at Mora Eileen, she's a very energetic woman, and according to her speech, she does everything. There's nothing that you can define that she was cancer. She had cancer, and some other people became with different names, but she managed. And right now, they do ask her, what did you eat, or how did you manage to improve your your health until to where you are right now? If you look at Highland, she's now very energetic, and the disease is no longer with her. It is now called cancer free, or she has recovered from the cancer. And this is what Equatoria TV best to do, gives you the story that nobody has ever touched. Because mostly in here, people go for medications, and after some times it becomes the other way around. But here it is a successful message for several people who are eyeing or looking for Texas lung cancer, to ensure that they get medications. They have many who have been referred to India and other parts of the world. But when they come at this particular place, they save, and through saving, they get fully recovered from the cancer. Once you follow the instructions, the failure of human being is following instructions. But when you follow the instructions, it means that you will have to achieve whatever you want. Also, she has talked of not listening to other people's words. Just be yourself and know where you're heading to and what you want to achieve. But definitely, to some people, it becomes very hard because you realize that you want to listen more from other people, but you don't want to listen for your mental. What do you think your conscience is telling you to do? And through that, you will live longer. And just to give you, cancer is, as I told you, it keeps on changing each and every time. It comes with signs of a certain disease, maybe like TB, as I narrated to you earlier. Uh, Cancer diseases came with TB. It changes to TB. You might think you are being treated for TB, but when you go for wrong medications, that it means you will have to go through some challenges. I had some interview with one of the cancer people a long time ago, and she told me one time she was diagnosed with what you call TB. After treating TB, her hair got lost, And after there, when they came to realize it is cancer, it was too late, and she had to succumb to from cancer. And that is definitely gives us what we call positive minds. If you set your mind to be positive, then it means a different thing because you will have a target where you're moving and where you are heading to. If you're watching us, thank you so much for watching us. Shortly, we'll be joined by Dr. Nyonkesa Catherine, who is the CEO for Cancer Texas Cancer Texas Cancer Center here in Nairobi. She will be giving us now more details about the life and what normal happens if you live particular life, what should be followed next? Because we say social life leads to what we call cancer. How far do you think it might be? So, Madam Hailing, just your parting shots as we plan to exit the place. What do you think it should be done in terms of medications worldwide? We have what we call universal health care. Do you think it has been achieved? Because you get to a certain place, they tell you if you don't have NHI, then we will not give you the medication. Do you think here it was used? And if you are outside Kenya or you are in the other world, what is your message to those people who are watching you? Maybe they are in Canada, Australia, India, Great Manchester, Cairo, Juba, Kampala, and they also want to come and get medications, specifically here in Kenya at Texas Lung Cancer Center.
Okay. NHIF inatumika NHIF sana sana. NHIF inasaidia kupitia kwa matibabu mingi. Tuseme kama mimi NHIF ilikuwa inanilipia kama 17,000, naongezea kidogo, sasa ilikuwa na reduce, kama nikiongezea 5,000, 4,000, 3,000, yani inafuatilia vile NHIF vile inakata, lakini NHIF inasaidia sana. Ukisema ati unakuja kuriba na cash, hautaweza. Juu iko ingine dawa yako saa zingine inastahili, kama sasa hivi tuseme wakati nilifanyiwa operation nilikuwa nastahili nakujanga kliniki inatumika almost 47,550, na hiyo pesa huwezi manage cash. Hiyo ni NHIF ndio inakusimamia, chenye itaweza kupakisia uongezee ni kidogo, si mingi. Lakini useme ati cash hutaweza. Ukiwa na NHIF ndio unasaidika na kansa unatibiwa. Kitu yenye iko challenging kama wale wenye hawana NHIF, watajaribu tu washike NHIF. NHIF inasaidia. Na Dr. Nyongesa NHIF ndiye anapendanga, kwa maana anasemanga hatuna pesa kasi. Sisi sasa tuseme kama mimi niseme mimi Irene, mimi siwezi kukua na pesa cash. NHIF ndio itaweza kuwa inanilipia. NHIF ndio imenilipia hivyo, na hiyo pesa ingine kidogo nikiomba marafiki wakinipea na kuja naongezea, nikiendelea hivyo mpaka nimefika mahali nimefika. Ndio maana nasema NHIF inasaidiana. NHIF ndio inaokoleanga. Wenye wako nje, wako wapi, wanastahili wakuje Texas Cancer, watasaidika. Madawa ikosi hapo, dawa yoyote yenye unataka iko hapo, na mgonjwa wako anatibiwa vile kulingana vile ameandikiwa na daktari. Dokta ako na wewe, anakuelezea, ukimhitaji anakuja anakuangalia, halafu anakuandikia dawa. Dawa ikosi Texas, dawa ikosi. Lakini tuseme wakati nilikuwa Kenyatta, dawa ilikuwa inakosa. Kama nilikuwa na rafiki yangu mwenye alikuwa Coptic, alitransferiwa kukuja Texas kwa maana dawa ilikosa huko. Tulikaa naye na mwingine alitoka Kijabe, na yeye alikuja Texas. Wengi wanatransfer kukuja Texas, tunapatana na waelezea, na waambia Texas Cancer iko na madawa, na hiyo dawa ukipewa usiende kuchanganya ile watu wanasemanga wacha nijaribu na hii. Hapana, dawa ile inapona, ile dawa unapewa na daktari unapona. Na hiyo ndio nimetumika. Kama mimi sasa nimeenda chemo 6, na hiyo nimefanyiwa hiyo ya kutoka huko, nimefanyiwa na nimepona, niko sawa. na naendelea tu kukaa, naendelea kuishi. Hiyo tu ndio nasema challenge nyingi ni pesa. Challenge nyingi ni pesa, pesa. Wacha tusikane mkono, tusaidiane, tuendelee, ndio tutatoboa. Na mwenye ako kwa nyumba analia, anasema ajiwezi kansa, naomba yoyote mwenye anajua ako na mtu mwenye ako na kansa ajiwezi, wacha akuje mpaka Texas. Akifika Texas atasaidiwa na Dr. Nyongesa na atapata madawa na atapona. Usikae kwa nyumba akilia akisema ajiwezi. Mimi vile niko hivi ni single mother na nimejaribu, nimeweza, na wewe utapata. Na usisema una, uko nayo ile chenye uko nayo, kuja ama uko na mgonjwa wako yoyote ako mahali, mtume Texas Cancer Kenya, atapata madawa. Madawa ikosi tangu asubuhi mpaka iko 24 hours, dawa iko, unapewa unapona. Vile nimepona, naombea kila mtu akuje apate madawa apone. Tukae tukishukuru Mungu na maisha inaendelea na tunaendelea kujipea Mungu. Juu tangu nianze kugonjeka 2019 mpaka saa hii nimeshika wengi wenye hawakugonjeka kansa. Mtu anagonjeka kidogo anakufa, mtu anafanya hivi anakufa, lakini mimi ndio huyu, mimi tena niko na nguvu na mimi najitegemea na inaendelea hivyo tu. Maisha inaendelea kusonga na tunaendelea na maisha hivyo tu. Peana moyo, ule mwenye ako naye akuja pewe madawa. Texas Cancer iko.
Thank you so much for our viewers who are watching us, and for those who haven't listened or have heard the languages that Highline is talking of medications and availability of medications here in Texas, Kansas, specifically when you look at, if you have that positive mindset and you give your other people morale, it means that you will have to evolve or come up with the solutions to whoever is feeling it is hard to her or to him, to ensure that she also achieves through this morale or through these positive vibes. She is able to impact the life of many, and she has changed the life of many, because other people think that when you are cancer, you've been diagnosed with cancer, that's the end. But in reality, it is a very different case here in Texas Cancer Center. For anyone who has come at this particular place, she or he has gone back smiling, keeping in mind that medications also prefers to what we call your positivity when it comes to mentality and when it comes to thinking. So if you think you will come out, also you will manage it. And through that note, we are able also to note several things that it's not a matter of going or spending a lot. It's just a matter of getting to understand each other, and here it's normal happens. Also, she has talked of giving out whatever you have, and also getting to reach to your friends and neighbors who can chip in with few smalls or whatever they will get to get or to help you and assist you achieve your medications, bills, and also whatever you have been missing. And through that, it is an interesting feature. It is an interesting story from Haile Mora, where she has been giving us more stories depending on concerning how her life used to be and how her life changed. And if you look at her, you can't know or you can't realize whether she was cancer, diagnosed with cancer, or she is just living her normal life as usual like other people's. And through that, it has an impact for those people who thought it is hard. It is now not hard as it used to be thought. That is what we call myths and misconceptions, particularly when it comes to cancer. It is now being rubbed out. Why? Some of people have witnessed the fruitfulness of cancer, and they are here to tell what they have experienced. For the meantime, as I've been told you, we will be joined, or we will be joined by the Dr. Nyongesa Wata. For the meantime, as we wait for him, as we wait for her, we wish to get and congratulate the message Highland has been giving us, specifically when it comes to matter of cancer and cancer recoveries. Being one of them from this hospital, Texas Hospital, it gives us or gives other people hopes and mileage, because when you see somebody who have gone through what you call tough situations and she managed to get out. It means that you are out of the country, and this means that you have achieved a lot, because what comes out is you have to specialize and you have to go according to what it is. Here we are at Texas Cancer Center. What can you learn from our last sessions and where we are? It gives us an impression that everything is possible, and whatever that we thought it is impossible, it becomes possible, and possibility matters a lot, specifically when you have what you call positive mindset, and also when it comes to what you think and where you are heading. As you can hear from the background noise, you can hear most of patients are being getting in each and every minute when it comes to medication. So which means Texas Cancer Center is the best place for you to be. And as we wait for Madam Nyongesa Wata Catherine, who is the CEO, I wish just to discuss one thing, to know how you can get out of this. As we talked last time with some of the medications, that cancer is a cause of a certain manipulation or multiplication of some cells that comes to hinder some of the normal process. For instance, you have what you call blood cancer. When it comes to blood cancer, it means that you have to go with what we call the medication. So the normality multiplication of some cells in the body, it means that you have to come out, and through that, it means that it is ready for you to come in a particular manner. And specifically, it is good for us to know what is going on and how it should be done. This is what we refer to as the cancer and how to diagnose it. And through that, I wish to exit our guest, Hyland. Thank you so much, Hyland, for coming. And it is good that we are so happy because you've given us the story, particularly when it comes to this matter. And we are so much glad because, specifically, when we get positive vibes from such people like you, we get to know specifically there's nothing which is impossible. Everything is possible, and they say if you believe it, it happens. And here you are, very safe. Thank you so much. I hope next time we will get you and discuss more and more. Just to say thank you for accepting our invitations to come for Equatoria TV interview. I wish you all the best. So, for our viewers, we'll be joining uh, Dr. Wata. She's just right here, and she will be telling us more about how Highline life was and how social life can impact what we call the, or how it can lead to what we call lung cancer, or cancer, whatever that is, any type of cancer. And Dr. Wata will be discussing more highlights of different cancers that she has dealt with, because Dr. Wata is the CEO for this CEO for Texas Cancer Center, and she also has another role as an oncologist. She will be telling us more about. Thank you so much, Mail. So we will meet next time. Thank you so much for coming to our interview. So through that, we wish to invite, or we will be getting in Dr. Wata, Dr. Wata, Catherine, and through the impact, we will be able to get the how it should be done and how it should be done. So through the individuals and some actions, it will be able for us to get more details. So through the impact, what comes out and what should be expected, the doctor will be giving us more info about how should we dress and for this particular revealed disease and what should be done. And particularly here, Texas Cancer Center, the expectation for from the patients, what they come and what they should expect, keeping in mind that it is affordable. Once you have any other documentations, insurance, or what we call the NHIF here in Kenya, you are ready to go. And particularly when it comes to matter of money, most of people fear coming to medications because of one, two, three, four. But it will be good for some to ensure that they come for the relief of the different diseases they have, to ensure that they go particularly as per what we call the cancer and instructions according to diagnosed diseases or the diagnosed Definitely. Thank you so much, and sorry for the experience that we've been experiencing. That is a technical hideout. So we are here with that is Dr. Catherine Wata, and we are so much glad to be here because we've been taking some of the stories from Highline Mora concerning how the life was, and keeping in mind that COVID-19 is here, and also the challenges she went through. This is Equatoria TV, the sessions that we think to give, and also at a very short period, we'll be getting the interviews, or we'll be getting more details concerning Dr. Wata, depending on how it should be done, specifically when it comes to matter of where, how. Social life has a lot of impact when it comes to what we call cancer, and what should be done for someone to be saved. Also, she will be narrating some of the highlights she noted during the Highline Mora's stories, as she had been giving us more details. And thank you so much, Dr. Wata, sorry for that, Catherine. And we've been going or getting positivity of what you do, what you does, and how wonderful you are. Keeping in mind that Highland Mora has highlighted some of the issues you helped her until where she is, and we are so much glad that Texas, you do what you mean. Thank you so much, and welcome to Equatorial TV. Just a highlight of what uh, Highline Mora was going through specifically. How did it go to be diagnosed, and how does it work when it comes to in terms of radio and chemotherapy?
So for her case and any cancer patient, cancer diagnosis is a medical diagnosis. So you have to involve a pathologist. You may have all the symptoms pointing towards cancer, but we need a confirmation by doing a biopsy. And the biopsy is the one that confirms you have cancer. Once you've gone through the confirmation stage, you have to do the staging workup. We know what stage the patient belongs to because the treatment options vary with the stage. We have surgery. Maybe in a nutshell, is that cancer treatment is multidisciplinary. So if it involves surgery, we have to involve a surgeon. If it involves radiotherapy, we have to use radiotherapy machines. If it involves chemotherapy, we have to infuse drugs in the vein or maybe by mouth. So it just depends on the type of the cancer and the stage. Mm.
We've looked at what we call losing of the hair. Somebody's lose their weight. What normally happens to radiotherapy when it comes to radio or chemo? What happens for that person to lose the weight and the hair?
So there are those general or generalized side effects of this treatment, whether it's chemo or radiotherapy. One of them is lack of appetite. So with lack of appetite, you just lose weight. We know that cancer is a chronic disease which also affects patients' appetite and nutrition. So the patients also lose weight just because of the cancer itself and the stress that comes with it. You know, when you're diagnosed with cancer, it's a stressful condition, just both from the cancer itself, from the treatment, the radio, the chemo. They all stress patients and they just lose weight due to stress. Um, it also involves walking back and forth, you know, traveling to the hospital back and forth. And just that journey also, you don't have much time, you know, to relax home and eat and settle. So it's a disturbed kind of period. So patients lose weight. Then when you look at the actual side effects like chemotherapy, many patients experience vomiting, nausea. So even that affects diet. Like they cannot eat well, or you always fear that I'm going to vomit. So you avoid much eating. Um, Hair loss can be caused by chemotherapy. Some of them they cause hair loss, and even radiotherapy. In case you get radiated near where there's hair, then that hair also gets lost, but it can grow back after you finished your chemo or radiotherapy. After some time, there's regeneration of the hair.
So thank you so much. Indeed, what you've just explained is what Highland had been highlighting out to us, and through this, it means you've been going far, or you've gone far to an extent where you can relieve somebody from the expectations and myths and misconceptions. Now, let's talk about the social, how social life can lead to what we call cancer, specifically our daily living, how it normally goes. And also we have what we call ignorance. Sometimes you experience something and you say, no, this will be okay. What is your take on this?
So they say everything we do for leisure or pleasure can be detrimental to our health. Um, I will start off with the just exposure to the sun. You know, sometimes it's cold, you want to go sit out in the sun, but prolonged exposure to the sun can lead to skin cancer. So it is important that you really balance the benefits of the sun versus the risk. So you cannot be out in the sun the whole day. It is not healthy. If you have to be out in the sun the whole day, then wear some sunscreen. Okay, if you are going to the coast now, the festive season is here. When you go to the coastline, walking on the beaches, you need to have some sunscreen. And if it is at home in the village, then wear a hat. It can also protect you from the harmful rays of the sun. Another thing is the if we our diet. If you eat a lot of fat in your diet, it can bring not only lifestyle diseases like high blood pressure, diabetes, but you can also be at risk of getting cancer. And then things like our sexual life. We know that cervical cancer is the commonest cancer among women, I think second after breast. So, and this cancer is brought by a sexually transmitted virus called human papilloma virus. So if you, and this virus one gets exposed when they are still quite young, and then it stays in the body for some time until it transforms the cervix to cancer. So if you are young and you use protection, for example, protected sex, then you also not only get avoid infections like HIV, and HIV also exposes people to cancer, but it also protects you against human papilloma virus, which we know also can bring cervical cancer. So those are just some little things we can do. Another one is use of tobacco and alcohol. We know that tobacco is one of the leading cause of cancers in the world. So as a lifestyle choice, if you choose to smoke a lot, then you know that you're exposing your body to a lot of carcinogens or cancer-causing things in that cigarette or in that tobacco, and this can lead to cancer.
So your final comment as we finish out, keeping in mind that somebody may be, for instance, last time I received a message from Yemen, the affordability when it comes to the medications. Uh, what is your take on this? Because some people feel they might be visiting Texas Cancer Center, and how someone can, the process on how to get detached or get to know or get to this place, specifically the contacts and the emails, how if somebody is outside the world or is watching from different parts of the world, the directives on how he can reach to this particular place.
So, in terms of cost of treatment, actually, we're one of the most affordable cancer centers in the country, because our focus is for the common man. And then our contacts, they can reach us through the phone. They call 0716-279-632, or you can reach us through our social page, Texas Cancer Center. You can email info at texascancercenter.co.ke. We are online. And say chemotherapy, we use most of the time, we use the National Hospital Insurance Fund. Even radiotherapy, it pays for like 70% of the sessions. So it is an affordable institution, and we encourage those who are struggling with cancer patients to refer them here, because we are equal to the task, and we are ready to help the needy patients in terms of offering affordable treatment.
So, as we finalize, what is your take on this? That cancer is mostly based to the grown-up people. For instance, I've been talking to one of my friends. I talked of a 13 years old child or kid having cancer, specifically the bacteria. I don't know if it is bacterial influenza or the other name. Do you think it is necessarily to the grown-up people or it cuts across?
Cancer can attack anyone, but we know that in our country, cancer in children is rare, and that is actually worldwide. In our country, we see over 47,000 new cancer cases, and only 3,000 are children. So it's a very low percentage in children. And cancer, when it's diagnosed in children, the cure rate is higher than adults. No one really knows the causes of cancer in children, why some children get cancer and others don't. But there are many risk factors that may lead to this. One of them is genetic, whereby children inherit some bad genes from their parents. We also have, if the parents are using alcohol and tobacco and it affects the baby, it puts them at risk. And then we have infections that are known to cause cancer in children. For example, Epstein-Barr virus, it can cause that type of lymphoma. We call it Burkitt's lymphoma in children. And then another issue could be maybe if the parents used some medicines which were not approved by the doctor during pregnancy, that can also affect the baby. So that is why it's important pregnant women should go for antenatal clinic to ensure that whatever medicine they are taking has been approved by the doctor, and so that it's safe for the baby. And there are certain majority of the cancers really we don't know the cause. Some just occur accidentally because we know that the child's body is growing, the cells are multiplying rapidly, and the errors or accidents occur in that during that period, and an accident or an error will occur in that genetic code, and instead of the cells multiplying to form an organ, they multiply to form a cancerous growth, which is uncontrolled, and because it's abnormal growth from an error that happened during this child's growth or during cell multiplication. Once it turns cancerous, then it becomes detrimental to the baby or the child.
So your last take.
Okay, this September is Child Awareness Month, and we trust that mothers or parents in general, or guardians, if you're taking care of a young child, you need to be their keeper. Look out for anything abnormal on that child. Trust your instinct, and if you feel that something is not right with this child, for example, the child is losing weight, they're just crying unnecessarily, they're complaining of pains and aches in the body, they're bruising easily, they have a growth on part of their body, um, they they're having some unusual infections or fevers that don't go away. A child who is having difficulties in breathing, don't take it for granted. It would be nice to take that child to a pediatrician who will take time with the kid, examine the child, and try to figure out what is wrong with the child. The goodness is that majority of the illnesses we see in children are not cancerous, because we know that cancer is rare in children, but only maybe 1 in 8,000 children may be having cancer. So the issue is picking this 1 in 8,000, and that will be the work of the pediatrician, who will really try to find out if there's a problem with this child. And if this problem could be cancerous, the pediatrician will take the next initiative and send this child now to have a medical diagnosis to confirm if it's cancer. Because cancer in children in developed countries is curable in 80% of them. And in our country, the cure rate is below 30%, and this is because of late presentation. So we want to see, as a country, how can we improve cures and move to the 80% where America and Europe are in that range of cure rate. And also, if you notice your child is not very playful, they like lying down, sleeping, it is unusual, or the child is refusing to eat, and you notice this is something that has changed suddenly over a period of weeks, don't ignore, just seek for advice.
Thank you so much, Dr. Catherine, for honoring our invitations. And this is the second time we are here. Thank you so much for also hosting us. Indeed, our viewers, it was a very wonderful pleasure to be with you. We have been getting some of the stories of the lady who been passed here through Texas Cancer Center, and she got medication. She's cancer free. And right now we've been having some sessions with Dr. Wat Nyongesa Catherine, who's the CEO and the founder of Texas Cancer Center. She been highlighting some of the various challenges they normally or the cancer people go through. Thank you so much for viewing us and wherever you've been. Let's keep in touch as a guide from Yemen. Your question has been already answered, so you can get now the reality of what you wanted. Right from Nairobi, I was your host, Kaka Juma. Until next time, let's meet here at Equatoria TV. Keep on watching our next program as we keep on interacting. Thank you so much from Nairobi, Kenya. Um, Kaka Juma.